Teen and preteen drug and alcohol abuse. The problem is as pervasive as it is poisonous, and experts say it's thriving in communities that may seem unlikely places for this high-risk behavior. Tonight, senior correspondent Marie Denoia Aronsohn begins a two-part series, Addicted in New Jersey, Teens in Crisis, with a profile of Morris County, its patterns and history of underage substance abuse, and its efforts to stop it.
It's no secret that growing up can be painful and confusing. It's a time when bodies are changing, social pressures are intensifying, self-images are forming.
Adolescents tend to be listen to their emotions. Often they don't even stop to think of consequences.
Megan was 10 years old when she took her first drink. She says her mom was an alcoholic.
So then I was like, maybe it will work for me to take the stress and pressures off me. So like I would just drink her alcohol, and it did. It was like that. It just like worked.
Ryan started smoking marijuana at age 13, which ultimately led to heroin.
I completely was out of control with drugs by the time I was like 16.
Both Ryan and Megan are from relatively upscale suburban neighborhoods, and experts say their stories are not unusual.
Kids that come from affluent areas, suburban areas, in our experience, tend to be involved with prescription medications, heroin use, way more than kids that come from the urban areas of New Jersey.
Heroin is on the rise, cocaine is on the rise, club drugs are present, ever present in communities.
New Jersey has the most potent heroin in all of the United States, and it's very easy to get a hold of, and it's very cheap.
And there are drug overdoses among youth every month, every week. You just don't hear about it.
And all it takes is one try and you're hooked. And it's a very, very sad commentary on what's going on in our community, in our county, in our state, in our country.
It's not pretty, but it's real. But it's something you needed to hear. All right, you ready to get this going?
This middle school program based in Rockaway Township is called Project Positive Choice. It got its start in 1998, a critical year for Morris County.
Project Positive Choice was started in 1998 because there were numerous heroin overdose deaths in Morris County. There were 22 to be exact.
It was a fierce wake-up call for this county of upscale neighborhoods and top-notch schools. And from awareness came strategies.
You need to start reaching these kids before they get to high school. If you don't catch them at in the middle school level, by the time they reach high school, it's too late.
So the main event today are our guest speakers.
Reaching kids with the message of prevention is mission number one for the Community Coalition for a Safe and Healthy Morris County. For them, data on alcohol and drug use among teens is an absolutely essential tool. Such information helps them zero in on specific targets and helps them go after grants to fund their programs. One of the most frustrating barriers to getting the information, a law that requires parents give active consent to student questionnaires. Originally, the law required passive consent, which means no parental signatures. Raquel Maison-Jeffers is director of the State Division of Addiction Services.
We have found it difficult working in certain school districts to get the response rate to the survey that we have been used to previously with this law in place.
Without data, we can't know what the problem is, and then we can't, we can't direct our efforts to those problems.
Senate Bill S-1696, which has passed the Senate Education Committee, is currently awaiting a floor vote. It would switch the rule back to passive consent, and prevention experts say would pave the way to more effective data gathering. Even as this battalion of addiction specialists wait for that green light, they continue strategizing. But the spread of addiction and the risk of serious complications are not waiting.
We've had 2 deaths since March. Both were under the age of 35, and a couple of near overdose deaths, and numerous ones that we don't even know about. And it's, like I said, it's very, very sad, but it's a problem that persists and something that we have to fight 24/7.
Tomorrow night in Part 2, in the trenches with Megan and Ryan, fighting addiction and fighting for their lives, and one father's story.
And I try to be strong through all of this. But this is where it ends up. Drugs win all the time.
Marie Denoia Aronsohn, NJN News.